Have you ever finished a meal and felt so bloated that your trousers are so tight? Most people assume it is something that they ate, but in many cases, the cause is completely different. Today, I'll explain why bloating is happening and what are the common causes of bloating and what are the signs that may indicate that you should see a doctor. Hello, I'm Dr. Ali Alattabi. I'm a gastroenterology doctor in the UK, and on this channel I'll explain digestive health in a way that's practical, evidence-based and easy to understand. So what is bloating? Most people think bloating means too much gas. Actually, bloating is the feeling of increased abdominal pressure, fullness, tightness. It is completely distinct from producing too much gas. And that's why it explains some people feel bloated without having an increased intestinal gas. Why does bloating happen? I will simplify it into four main mechanisms. One, gas. So everyone produces intestinal gas, usually around 500 ml to 1500 ml per day. Most of this gas pass naturally. In many cases, gas isn't actually the problem. The second mechanism is gut sensitivity. This is fascinating because many patients assume that more gas is equal to more bloating or vice versa. Actually, many patients with irritable bowel syndrome produces normal amount of gas, but they are more sensitive to normal stretching of the bowel. And this is in our medical term, we call it visceral hypersensitivity. I'll give you an example. So imagine two patients produce the same amount of gas. One feels nothing, the other feel too much bloating and discomfort because their gut is more sensitive. The third main mechanism is constipation, and this is one of the commonest things I see in a clinic. With constipation, you have a slow movement through the bowel, and as a result, there will be more fermentation of the bowel content. This will result in increased pressure within your bowel. As a result, will cause bloating. Fourth mechanism is food fermentation. I don't want to go into details into this, but the basic idea is some food, especially carbohydrates, aren't fully absorbed in the bowel. As a result, there will be more fermentation by the gut bacteria. This will result more gas and then bloating. Now, I want just to mention a few myths that I hear during my practice. Number one myth is bloating means too much gas, and as we explained earlier, that's false. Second myth, bloating caused by food allergy. That's false. Actually, food intolerance are more common than food allergies in adults. The third myth is prebiotic is the treatment for bloating. The evidence base is some strains help some people while don't help the others. It's very difficult for us to recommend prebiotic. However, it's kind of like a trial. It may work for some people, but it may not work for yourself. Now, when people should seek medical advice, in our practice, develop certain criteria that we call it red flags. What you should observe for, try to seek medical advice. This is mainly unintentional weight loss. If you see any bleeding with the bowel movement, night symptoms, that means you wake up in the middle of the night, you have a bloating, or you have bowel movement in the middle of the night, that's new for you. Also, if there's any change in the bowel habits in elderly patients, difficulty swallowing or recurrent vomiting, these might warrant medical advice and get assessed because you might need to have further investigation. Now, I just want to reassure you that in most bloating isn't caused by something serious, but this is kind of like a safety net that we give to the patient, that if this has happened, it may be something else that's going on. Now, I would like to give you some practical advice if you ever experience bloating. Try to eat slowly and avoid large meals if they persistently cause bloating. Stay active, walk, do exercise, because this will help the circulation in the body. As a result, help bowel to be more efficient and more active. I see most patients eliminate diet and trying to avoid food. That's fine, but before you go and eliminate most of the diets in or food in your diet, I would suggest that you keep a food diary. See when your symptoms are happening and see if you could correlate that with the type of food that you eat. Obviously, you could exclude some diet, if that some food types, if you think they are related to your symptoms, rather than excluding all of them from the beginning. And as explained earlier, if you've noticed any red flag symptoms, or your symptoms don't improve with these simple measures, then maybe it's a time to see your doctor or your GP. So I hope with this video I answered the most common question I received from my patients in a clinic, and that's, doctor, why I feel bloated and is there something wrong with me? So this is what I do in the clinic. First thing, I reassure them that most bloating isn't caused by anything serious. We discuss the pattern of bloating and how it happens, and try to recognize if there's any red flags that warrant further investigation. If you find this is helpful, consider subscribing. I will be sharing more videos on digestive health and answering common questions I hear from my patients in everyday clinic.